Hello, Buffy Stinchville here, physical therapist, owner of Pinnacle Women's Therapeutics. I specialize in the pelvis, pelvic floor issues, women's health, and the female athlete. Today I want to talk to you a little bit about posture when we go running, because there's a lot of us after we have our babies, we want to get back into shape, we want to get that good calorie burn. We often revert to what we did before to lose that baby weight. So we go back to running. So the only issue is after our bellies have completely expanded and come back, our core is left weak. There's going to be a good time period where it takes a lot of effort to get that strength back. Often women are back to running and cleared for running by their doctors really early on when you know that the core muscles are not back. So one of the things that can happen with running is with a weak core is we collapse our stomach a bit, and you'll notice that when we do that, the neck and the chin go out. When we have a taller stomach, the chin and the neck come back. This is an issue because if you look at the pelvis, if we collapse our stomach, our pelvis tilts underneath us a little bit, versus a tall stomach, it comes back to here. Now, if we look at the bones of our pelvis, so we've got our tailbone here, and we've got our pubic bone here. If we are tucked under with our tail, everywhere under here is the pelvic floor and the opening of it. So that is very exposed. There's nothing holding those organs or helping the pelvic floor at all. If we realign our position so it's more neutral, we have some forward bony support for the organs, and they can kind of rest into the front of the pelvis or the pubic bone area. And that can make a huge difference for women that have issues with leakage with running, with sprinting, as well as feeling pressure if they're having early signs of prolapse or just dealing with an ongoing prolapse condition and they don't want it to worsen. So the big tip here is to focus on a longer, taller torso or core or stomach, along with the neck brought in. They usually go together. So if it works for you to focus on this, running more lengthened and tall here without flaring your ribs, keeping that down, but just long, or thinking about not letting your neck do this and bringing it back in. Either one works. Just pick one. You don't have to focus too hard on too many things while we run. It never works out well. But if you have any questions, you can always message me here. And stay tuned for the next video for more tips for your health. Thanks.